Good morning. Before I get started, I want to certainly recognize and thank the frontline workers who are helping us battle this illness. We greatly appreciate their service to the state of Georgia. I'm here to talk about staff augmentation for nursing homes, hospitals, and for our state hospitals through the Department of Behavioral Health and Developmental Disabilities. To date, we have 15 hospitals statewide with a total of 417 healthcare providers. We've partnered with Healthcare Workforce Logistics, otherwise known as Jackson Healthcare, to help staff these hospitals. Nursing home facilities, we have 54 nursing home facilities statewide with a total number of 302 healthcare providers in those nursing home facilities. And of the 5 state hospitals that I mentioned, 251 healthcare providers are providing care in those facilities. We also have 1 community living home down in the southwestern part of the state where we are providing staff as well, for a total statewide number of 970 healthcare providers. The second biggest issue that we were challenged with was in our nursing home facilities related to surveying work. The CMS required that we complete 358 surveys by July 31st for focused infectious disease control. Of those 358, 291 have been completed, with 67 remaining. We should be on target to meet that July 31st deadline. We have partnered with 2 private companies to assist us. So with the Healthcare Facilities Regulation Team, along with CMS support, along with those 2 companies, we will meet that July 31st deadline. The additional component that we did to help with the nursing homes is 257 nursing homes are participating in the Temporary Nurse Aid Program. That was an initiative where we partnered with CMS to provide online training so that we could get more staff involved and engaged in supporting the residents that live in those nursing homes. That has been a significant success so far. As people have gone out with the illness, we've been able to replenish those staff by using those temporary nursing aides. I'll be happy to answer any questions at the end, and thank you very much for your time.